In this video we demonstrate the step-by-step process of a primary vitrectomy for Rhegmatogenous Retinal Detachment. In this case shared by Dr. Ricardo Leitão Guerra from Salvador, Brazil, a patient presented with a retinal detachment recently involving the macula, associated with a single superior temporal horseshoe tear. The patient had a visual acuity of 20/60ths at this time, and a primary pars plana vitrectomy was planned. After the placement of 25-gauge trocars and the Chandelier, the surgeon performs a core vitrectomy. Next, he engages the posterior vitreous near the nasal margin of the disc and moves the vitrectomy probe towards the more peripheral region, increasing the vacuum to induce posterior hyaloid detachment. The vitreous tractions and the flap of the horseshoe tear are removed, and the vitreous base is examined 360 degrees to evaluate the presence of other tears. The surgeon decides to use perfluorocarbon. This heavy liquid is useful in this type of surgery to both flatten the retina and drain the subretinal fluid, as well as to condense the peripheral vitreous base, facilitating its removal. This is especially useful in cases where the patient is still phakic, as in this surgery. After completing the shaving of the vitreous base, the surgeon performs a fluid-air exchange. Note that the eye is tilted towards the tear until all subretinal fluid is removed. After completely drying the margins of the tear, he aspirates the perfluorocarbon and applies laser around the area of the temporal tear. SF6 gas at 20% was used at the end as a tamponade agent in this case, with excellent anatomical and functional results after 1 month of surgery.